for KCPE and KCSE, we are surprised and we go at all length to find out where our girls are. You find the question papers has been placed on where she is supposed to sit, and yet she's not here. When you try to find out, you are told she got pregnant, she got married. And indeed, that trend must be, by all means, reversed. Lazima tutafute njia ya kutoa hiyo mwelekeo, kwa sababu si mzuri, because it draws us back, inaturudisha nyuma in as far as our future as a county is concerned. You are aware the government policy is that we need 100% transition. That means all those girls and boys who start at KCPE are supposed to transit to the next level. And come next month, we really want to work on that and ensure, because all our girls and boys have all been admitted to secondary schools. Boys, so that they progress and they become responsible citizens in the future. And one of the issues that has been identified by you is the issue of early pregnancies and gender-based violence. And I want to add, you cannot talk in this county about early pregnancies without talking about FGM. Because I think they are related in the sense that one is perpetuating the other, especially FGM is perpetuating that early pregnancies. And therefore, I think it is a starting point that we need as a community of West Pokot, regardless of your position, we have to work together to find a long-lasting solution to the problem of early pregnancies. All of them are set to Form 1 August. And therefore, this is really a meeting which is coming at an appropriate time. And it is my belief that you will come out with strategies and plan or a roadmap that is going to address this vice. Sometimes we are very good, as Christine was putting it, as putting up good papers, and then after what happens after a one-day workshop or after two-day workshop, what happens? Nafanyika nini after mkutano? Si naishia hapo. Sasa tumeshukunywa chai, tumekula chakula, tumepata pocket money, hallelujah. And then now another organization now sits.
The focus, ideally, there are so many. Maybe these are young girls. There's no maybe role models who are guiding these girls how they are supposed to behave. And even the parents, I think parents have abdicated their duties. They are not taking charge of their children to show them the right way or the right thing to do. Like in West Pokot, if you go to some other places, parents do not even know where their girls sleep. They go to the neighboring homes to get sleep. So we've not even provided conducive environment where our kids or our children stay at home. And then also technology. We find that information, these phones, these kids can get information at the fingertips, and they find themselves messing up and ending up in pregnancy. And then if we talk of family planning issues, I think we've concentrated so much on adult services. There are no facilities that are youth-friendly where they can go and get some advice. The CC in charge of health, sanitation and emergency services, West Pokot County. So today we are here to form a technical working group on issues to do with the teenage pregnancy. We want to end the teenage pregnancy because it is a real problem in the country as well as in the county here in West Pokot. As we know, West Pokot is the second leading county in terms of teenage pregnancies. So that one has impacted negatively on the girl child because they cannot access education. They cannot complete their studies as scheduled because of teenage pregnancy. So we are here to form this team, which is multi-sectoral. We have even the youth involved in it, the national government, the county government, and other non-governmental organizations who have come on board so that we form a strong team to ensure that we reduce or rather eliminate teenage pregnancies in the county. Because NASH is just next year, so but we are still very far as a county. So after this, we want to look at the action points and see to it that they are implemented. So otherwise, as a county government, we are committed to ensure that each child gets the opportunity to go to school and complete their school. But because of this issue of teenage pregnancy, it's taking us back. We also want to see even those who've gotten pregnant and delivered, do they continue with the education? We want also to see that those who are pregnant, are they getting good medical care or services? So those are the issues that we are looking at here. And as a county government, we are committed to support one another with their partners to ensure that teenage pregnancy becomes a thing of the past.
They should be domesticated at the county level and should be informed by the context on the ground, because no county is similar to the other in terms of the drivers of teenage pregnancy. But more importantly, we need to engage the communities in identifying some of the drivers of teenage pregnancy, and then the community should come up with their own community-specific strategies to curb this problem of teenage pregnancy. That's my take. And the issue of blaming each other is not there. And then avoid running parallel programs. The NGOs, the private sector, the public sector should work together in addressing the problem affecting the girl child. And we should also focus on the boy. Most of these pregnancies are coming from men. So meaningful male involvement in resolving, in coming up with the innovative strategies to end teenage pregnancy should be a priority. We should not leave out the name is John Anampio. I'm the regional population coordinator for North Rift, and today we are here to launch the West Pokot County Technical Working Group on ending teenage pregnancy in this particular county. My point of view is that this county is one of the counties that have been affected adversely by the cases of teenage pregnancy. From the Kenya Demographic and Health Survey of 2014, it was realized that West Pokot in the region was second to Narok in terms of the level of teenage pregnancy, which was estimated at 29%. 29%, where the national average was estimated at 18%, which means, therefore, that West Pokot's estimate of the burden of teenage pregnancy is above the national average, way above the national average. This therefore means that if from estimates, surveys, from health statistics, we find that there are quite a number of cases, it means the situation is even is worse off. Now, in terms of response, this calls for stakeholder multi-sectoral approach, bringing on board the government, policymakers, the county government this time, because they are the ones who are running with the service and delivery in terms of prevention and mitigation against the teenage pregnancy. Now, at the national level, and also to a large extent at the county level, we need to harmonize our policies the Ministry of Education policies should be harmonized with the Ministry of Health policies. For example, the adolescent reproductive health policy should be now reviewed, because some of the proposals and some of the objectives, some of the strategies that were proposed in the policy have been overtaken by events, particularly with the effect of COVID-19. At the school level, we realize now we have to change our policies. The back-to-school policy should be reviewed. Why? Because right now, given the burden, we have to accommodate those teenagers while they are pregnant to be in school. The Minister for Education has already allowed that one to happen, but I'm hearing that in our community here in West Pokot, there is a school that has resolved to be sending away all teenagers who get pregnant from school. That now, the county is going against the national policy on back to school. With that, a plan of action, a multi-sectoral plan of action to lead the campaign against teenage pregnancy, and also to be ambitious, a platform for reporting to the National Steering and Technical Working Group on ending teenage pregnancy, which is coordinated by the Ministry of Interior, the Ministry of Planning and of Treasury and the Planning, particularly the National Council for Population and Development, providing the Secretariat. So, and it should be prioritized, and we should put more resources in addressing that, because it erodes teenage pregnancy as the potential of eroding all the development gains that we are realizing in other sectors. So poverty reduction, gender inequality in education, another inequalities because of even SDGs. We cannot realize the SDGs if we ignore teenage pregnancy. SDG number 3 on health and well-being stands at risk if we don't address the issue of teenage pregnancy, because it aims at improving maternal and newborn health. And therefore I think that is a priority, and even it calls for us to do a national survey on teenage pregnancy. Let be it. Let the stakeholders come up with a national survey and the content-specific or focused studies to understand, to deepen our understanding on the issue of teenage pregnancy. With that, I think we shall achieve other development milestones as well. Thank you very much. At county level, if we rely on the county technical working group, we shall miss the point. We shall be missing the point, because the real action is at the ward level, at the village level. So we should come up with ways of developing these efforts with the leadership of the county technology, and then come up with ward-specific initiatives which are informed by village environment, local context, to address teenage pregnancy in a more sustainable way. Because you realize that Kapenguria, Makutano is quite different from Alale, which is right in the interior. So we should really develop interventions and put resources for local context-specific solutions. And we should also involve the institutions that exist, the institution of the elders, community elders, the institution of government institutions like the Nyumba Kumi initiative. So all those should be brought together and appreciate that teenage pregnancy is one of the major threats to a social and economic transformation of this county. That should be the case. Yeah.
The Gender Equality Campaign Coordinator from WIAC, Youth in Action, and we are in West Pokot raising awareness on teenage pregnancies and gender-based violence in line with the Generation Equality Campaign Forum, as well as the commitments that Kenya has made for generation equality in terms of ending GBV and all its forms by 2026 and towards realization of gender equality by 2030. So one of the many things that in West Pokot contribute to gender-based violence are heightened. One of the things, sorry, can I start again? In West Pokot, we do have a high rate of different forms of gender-based violence, such as teenage pregnancies, physical assault, defilement of young women and girls. We're here to raise awareness on gender-based violence and all its forms, and calling on different policymakers to join hands with non-state actors, civil society organizations, youth-led organizations in elimination of this vice. The challenge in West Pokot is quite complex because, one, it is a highly patriarchal society, and men are the beginning, middle, and end of all conversations in West Pokot. It is prudent that it is time to realize gender equality in West Pokot and call out all forms of gender-based violence, and we need men to be part of this discussion. As a highly patriarchal society, West Pokot needs to have male champions to call out gender-based violence and the different forms of GBV in its county. I'm happy that young youth advocates who are joining hands with policymakers to start working on the implementation of the commitments made by the Kenya government towards the realization of gender equality and especially the elimination of GBV and its forms by 2026. President Uhuru Kenyatta made a commitment to eliminate FGM by 2022, and today we are happy that young people have joined hands with the technical working group to partner and form solutions towards ending this vice.
To really deal with the issue of teenage pregnancy in West Pokot. By the way, West Pokot is also the second in Kenya, so it's actually one of those contributing counties to the issue of teenage pregnancy as Kenya's number 3. And really it's for us, and I'm excited that today we've partnered with the National Council of Population and Development and the different stakeholders in the county, and of course the county minister as well, to be able to form the county technical working group, because we are committed to ending teenage pregnancy. And Sauti Sasa, we are also saying that the youth-led accountability model, because we often leave out young people in the whole process of dealing with this teenage pregnancy. They are the ones who are living in it. Can we also have an accountability model that will hold us accountable as stakeholders, as practitioners, to be able to deal with this issue of teenage pregnancy? And if we look at the statistics, AIDS is leading in terms of the mortality rates. But then the second issue that is, dealing in terms of adolescent mortality rates is teenage pregnancy. And really, it's something that we really must address, because it's in terms of because they're not very ready to give birth at that very young age. They end up we end up losing them in terms of death because they are not ready, and we really need to create a safe environment for them to be able to pursue their education, to pursue their dreams, and then they can be able to venture into that. But really it's for us to say that we must address the issue of teenage pregnancy, because it's the second highest cause of teenage pregnancy deaths in this country. Thank you. So there's an intention for us, and as I say, when we're saying about multi-sectoral approach, we're looking at having a national teenage pregnancy awareness month. And as you know, August is the youth month, and we're saying teenagers, youth are the same thing. Can we have a robust engagement in the communities, that in a way that all the stakeholders, everyone in the community feels that they are responsible in dealing with the issue of teenage pregnancy? And we have continuously engaged Kenya women parliamentarians to be able to table a motion in such a way that even the government invests in that teenage awareness month. And we are also saying that, health is a devolved function. How can we also have these counties invest in, the teenage awareness month, and also just that awareness month will be an opportunity for them to be able to rally even more stakeholders towards having a county robust referral system towards ending teenage pregnancy. That model is really the youth accountability model. And what we've done is that we have established very solid Sauti Sasa action groups, and really for us is to be able to build their skills, to give them platforms for their voices to be heard. And even what we've been pushing for in all the county technical working groups that have been formed, we have ensured that these young people, we have at least 2 representatives in those county technical working groups to be able to air the issues of young people, but also to hold these stakeholders accountable. Because one of the things that the county technical working group is supposed to have is an action plan, and that action plan is a commitment by these stakeholders to be able to address the issue of teenage pregnancy. So then these young people come and hold these stakeholders accountable to the commitment that they will have made in the action plan. And one of the things that we are also the technical working groups will be having is the quarterly reports that they will be submitting to the president. Then we can be able to track, are these stakeholders actually realizing? And of course, the youth also will submit their own report showing that this is what stakeholders are committed and this is what has been done. Can you please be able to accelerate some of the commitments or the requests that we have to the County Technical Working Group? And we are here really to support the government and especially on the President's commitment to end teenage pregnancy by 2030. And we really adopt this model, commend this model of County Technical Working Group, and really is to say that teenage pregnancy has been an issue in this country for a very long time. And the County Technical Working Group will give us an opportunity to be able to have a multi-sectoral approach to the issue of teenage pregnancy. And as you know, that Kenya is actually the third in the world in terms of leading in terms of teenage pregnancy. And as stakeholders, we really must come together. We must be able to join the dots. We must be able to have a robust referral system so that even while you're talking about teenage pregnancy, that teenager can be able to access information. That teenager can be able to access service delivery. That teenager can be able to have a safe space if the community is no longer safe for that person, for that adolescent to be able to live in. And
Kenya mzima, sio hapa Pokot peke yake. Watoto wengi hasa wakati COVID-19 iliingia, ilileta shida mingi sana kwa sababu watoto wengi waliweza kupata mimba bila kutarajia. Na kuna njia nyingi ambaye zamani katika culture ilikuwa nafunga watu wasifanye tabia aina hiyo. Lakini kufikia sasa kuna mambo matatu ambaye imefungua milango ya watoto kupata mimba. Moja ni mambo ya social media, kuangalia masimu, alafu mengine ni restrictions ambayo Pokot walikuwa naweka imefunjwa sasa, kwa sababu wanasema sisi tunategemea sasa mambo ya kanisa, na kanisa sasa haijaweza kuwa na nguvu ya kuweza kufunza watoto kuacha tabia ya kupata mimba ya mapema. Kwa hivyo leo ni siku muhimu sana, kwa sababu tunajaribu kuangalia kwamba hii tutafanya strategy gani kuhakikisha kwamba haya mambo ya watoto kupata mimba mapema inakomeshwa, ili watoto wapate kuendelea na masomo na kuendelea kujenga nchi. Ajabu ni kwamba katika jamii ya Pokot hakuna msichana wa miaka 30 ambaye ameweza kuitwa nyanya, kwa sababu huyu ambaye anapata mtoto akiwa miaka 13 kufika miaka 30, ile msichana wake ikiwa alianza kuzaa msichana atakuwa amezaa tena. Kwa hivyo ataitwa gogo at the age of 30. Kwa hivyo hiyo ni hasara kubwa sana katika jamii na ni aibu. Badala ya mtoto sasa kuwa mtu mzima ya kuenda kuishi boma yake, anaanza sasa kuitwa nyanya na yule mtoto ambaye alizaa mapema, na ni hatari sana. Kwa hivyo mimi kama mwenye nasimamia maneno ya utamaduni ya Pokot, sisi tunakemea hiyo tabia ambayo imejitokezea sasa, na tunakemea hata vile hii shetani ambayo ilileta COVID, ambayo ilizuia watoto kuzuilia nyumbani. Hiyo kitu tumelaani, na tunataka kwamba watu waendelee kujilinda na kujikinga na kufunza watoto yao. Hasa wasasi lazima wawe na jukumu ya kushughulikia watoto wao, kuhakikisha kwamba wanajiepusha na mambo ya kupata mimba ya mapema. Kwa hivyo